The signs and symptoms of TB.
Shortness of breath, pain in the chest,
coughing for a long time,
night sweats,
blood in spit, weight loss.
Does anyone want to tell me what they understand TB or tuberculosis is? TB is an infection that people tend to get. It's caused by a germ called Mycobacterium tuberculosis, which is actually quite a cunning germ because it's slow growing and it doesn't act like your normal germs and bacterial infections like you get in the winter time. As I say, it's very slow growing and it has some unique defense mechanisms which can make it difficult to treat, but it is treatable and we can cure people with TB. Anybody can get TB. If you've had TB in the past, it doesn't make you immune to getting TB again. It can affect any part of the body as well, but it tends to affect people's lungs or their respiratory tract, we say, but it can move anywhere else in the body. With the body's defense mechanism, about 4 out of 5 people who get infected with TB tend to clear the infection without any problems. It's spread from person to person. Normally people who have TB that's affected their lungs tend to be symptomatic, they tend to cough, and if they're coughing out the germ, the bug, other people can catch it. But actually it's not that easy to catch. A lot of people think catching TB, that it's highly contagious, that it's very infectious, like flu or anything like that. But actually it's fairly difficult to pass on to other people. If you have infectious TB of the lungs, you need to be coughing quite severely, and for somebody else to get it, they actually need to be in very close, prolonged contact with somebody who's coughing a lot, which is why we tend to see most people who develop TB are those who have very close contact with people, such as people living in the same house or having very close working relationships with someone who's got TB. It's not as infectious as flu or other things that people are quite used to. We tend to find that there's a high rate of TB in ethnic communities for a variety of reasons. One of the main reasons is because of the travel links that people in the ethnic communities have with their home countries, whether it's in South Asia, whether it's in Sub-Saharan Africa, East Africa, or the Far East. These are places where TB is more endemic. There is more TB in these countries, and so the likelihood of people developing TB who are exposed in these areas is much higher. And if we have established travel links with people in these countries, whether it's family members coming over to visit here or people from here going to visit there, there is more exposure to TB. And that's one of the reasons why TB is more common in ethnic minority communities. TB is a bug, a germ, and it doesn't in itself differentiate between different ethnic groups.
It's nice to say that TB is curable. It's a mycobacterial infection that we have antibiotics for to treat. However, like any antibiotic treatment, it is essential that the course is completed and that medications are not missed. It's quite a lot of medication to take for 6 months, but it's imperative patients are supported and encouraged and understand that they need to take their medication every single day until the last pill is swallowed. Otherwise, more harm than good can actually occur. But yes, TB is treatable.
People should be educated about TB because it's not something to be afraid about. It's not a death sentence. It's just to make people aware of what TB is and it is curable.
Creating awareness about TB is very important because it is a disease that is quite well known in the community, but is associated with a lot of issues and stigma and false perceptions around TB. Hence, it is important for people to realise it is an infection, it is passed on from person to person. It's not something that we should try to cover up. We need to be able to diagnose it. People need to be aware of the signs and symptoms so that they can see the family doctor straight away whenever they suspect that they are ill. The sooner they see the family doctor, the sooner it can be diagnosed. The sooner it can be diagnosed, the sooner they can be started treatment.